So today we're going to talk about benign prostatic hyperplasia, some symptoms and the mechanisms. So if we think about this clinically, for someone who has a prostate gland that has become hyperplastic, they may be feeling an increased frequency, difficulty starting urination, a weak stream, pain during urination, an inability to completely empty the bladder, and an increased frequency at night, which can all lead back to an increased frequency again and begin the cycle again. So some clinical names for these are urgency, hesitancy, dribbling, dysuria, urinary retention, and nocturia. So let's now think about the mechanisms of these symptoms. First, you're going to get prostate hypertrophy in the periurethral zone of the prostate. This will lead to a constriction, which will lead to a difficulty to pass urine. The urine builds up, causing greater bladder contractions to overcome that pressure in the periurethral zone, which then can ultimately lead to bladder hypertrophy. So if we'd like to look at that in a diagram now, first we have a normal urination occurring with a normal prostate. Bladder fills and then the urine is emptied. Now we can look at a hyperplastic prostate, where the prostate has constricted that urethra. You need a greater force of contraction to release the urine from the bladder. And now in a little bit more detail, the detrusor muscle has to contract harder and work harder to overcome the pressure in the urethra. You can also have these hyperplastic nodules that can block the urine from passing, which can ultimately lead to urine retention. And then you finally get the detrusor muscle hypertrophying in the bladder, as it's always going to be contracting harder to overcome the pressure in the urethra. And this can lead to irritation of the bladder, and ultimately a hypertrophy of the bladder leads to less filling, which increases the urgency and frequency of urination. So these are the mechanisms that underlie these symptoms. Thank you.